When do girls start puberty? Girls generally begin puberty about 2 years earlier than boys. Puberty for girls usually starts between the ages of 8 and 13. However, Black and Hispanic girls tend to start puberty earlier than white girls, age 7.5 instead of 8. The Tana Stages also outlines the stages of puberty for girls and when they're likely to occur. There are separate Tana stages for breasts and pubic hair. The Tana stages can serve as an excellent guide to the changes you can expect to see in your daughter. There are 5 stages of puberty for a girl's. Stage 1 is prepubertal. In this stage, girls haven't experienced any visible changes. In stage 2, physical changes begin between the ages of 8 and 13. Girls typically experience their breasts begin to bud, and their areolas, pigmented area around the nipple, enlarged. Scant pubic hair appears. Height increases by about 2 3/4 inches per year. In stage 3, physical changes speed up between the ages of 9 and 14. Their breasts continue budding. Underarm hair begins to grow, and pubic hair continues to grow. Pubic hair is coarse, curly and in the shape of a triangle. A growth spurt of more than 3 inches per year occurs. Their skin becomes oilier, and acne develops. In stage 4, puberty hits full stride between the ages of 10 and 15. Their breasts continue growing, and their nipples start to protrude. Pubic hair is still in the triangle, and there are now too many hairs to count. Growth may continue at the rate of about 2 3/4 inches per year. Problems with acne may continue. Periods, menstruation, typically start around age 12, usually around the same age their mothers' and sisters' periods began. Some girls, especially those with disordered eating, start later. Stage 5 is the final phase. Development typically ends in this stage. Girls reach physical adulthood. Pubic hair may extend out to their thighs, and some girls may have a line of hair up to their belly button. Most girls attain their peak height by age 16, but some may continue growing through age 20. What kind of emotions do girls go through during puberty? All girls go through emotional changes during puberty. Some are affected more than others as estrogen and progesterone cycle through their bodies. The combination of social and school pressures and the moodiness can cause emotional outbursts and conflict with parents. You may think your sweet girl has turned into a mean girl when you see her actions impacting others. It's worth providing her with a safe space to feel all her feels, or share her emotions. Step in whenever there are issues of safety or morality, and otherwise provide safe harbor for her to explore her new identity. Avoid being a helicopter parent or a snowplow, shoveling all stress out of her way. Allowing her to learn from her mistakes, as long as they're not life-threatening ones, shows your confidence in her ability to problem-solve for herself. If you see signs of anxiety, depression or other mental health challenges, share your concerns with her healthcare provider. Sometimes, prescribing hormonal therapy, such as birth control medication, can ease symptoms and improve mood. Other times, she may need counseling or other medications to help manage moods and build skills to develop resiliency and fine-tune her strengths. What if puberty hits really early or late? Not everyone will go puberty at the same time. Some girls begin to see changes very early, which is called precocious puberty. Other girls may not see changes until later, which is sometimes called delayed puberty. Precocious, early, puberty. A few red flags signal unusual development in girls. These include, showing signs of puberty before their 8th birthday. Body changes that progress very quickly. Body changes that occur out of order, such as starting periods before developing breasts. A major disconnect between pubic hair development and breast development, such as no pubic hair but fully developing breasts, or vice versa. If these occur, mention it to your child's healthcare provider. Simple testing can help determine the cause of precocious puberty, such as, the pituitary gland may have turned on the hormones too early. A tumor may be developing on the adrenal gland or elsewhere. Your daughter may have been exposed to estrogen, through estrogen cream, for instance. Your child's healthcare provider may simply wait and monitor your daughter's progress, or refer her to a specialist for tests. If needed, an endocrinologist can prescribe puberty blockers to hold puberty until the appropriate time. Puberty blockers are medications that prevent your child's body from producing the sex hormones that cause the physical changes of puberty. Delayed puberty. If your daughter starts puberty very late or doesn't seem to be progressing through puberty, it's also worth asking her healthcare provider about it. She may just be a late bloomer, especially if her mother was. However, hormonal problems or disordered eating are other possibilities. If your child's healthcare provider suspects an underlying problem, they may refer your child to a specialist for testing and management. A note from Cleveland Clinic: puberty can be a very exciting but challenging time in your child's life. Along with physical changes, your child may also experience many emotional changes. Most children start puberty between the ages of 8 and 14. If you have any concerns about your child's development, reach out to their healthcare provider. They can evaluate your child and determine if they're developing properly.